Hello, party people. This is Zach Couples bringing you another movement deep dive. And today we're going to talk about everyone's favorite exercise, the 90-90 hip lift. This is an exercise that has been made popular by the Postural Restoration Institute. But I mean, there's also variants seen quite a bit in the literature. I think McGill did a research article showing this as the Levitt or Lewitt. I think it's pronounced Levitt actually. So there's lots of variations of this. I'm going to show you the ones that PRI predominantly teaches. So why are we using this activity? There's a two-factor goal with this. What we're trying to do is predominantly normalize trunk and pelvic position in the sagittal plane. So if I'm going to bring my guy here, a lot of people present with an overextended posture either on one side or both sides. And so what's going to happen is you'll see these ribs start to flare up, and then the pelvis is kind of tipped anteriorly. You may see that way, or it may just occur on the left side, something like this. All right? When I am in that type of position, range of motion is going to be limited. As we go into extension, we are borrowing mobility and degrees of freedom from the frontal and transverse planes, and especially a little bit sagittal too, because sometimes you'll see people limited in attempting to flex. Okay? So we're trying to improve upon that so we can increase the degrees of freedom that we have when we're moving. The way that we do that is by first achieving a zone of apposition. So what that is a zone of apposition is the amount of the diaphragm muscle, which would be underneath here, the amount of the diaphragm muscle that is lying directly next to the rib cage. So if my ribs are popped up like this, the diaphragm is descended. So the zone of apposition is smaller because the diaphragm is doing this while the rib cage is doing that. I have an improved zone of apposition if the ribs are pulled down like so and the diaphragm's ascended. And that's because more of the diaphragm is lying right next to the rib cage. So that's step one, and one reason why we might use a 90-90 hip lift. The other reason would be to normalize the pelvis, step two. And so because this pelvis is a little bit hypomobile, I'll bring this guy here. Okay? So anterior pelvic tilt or one-sided anterior pelvic tilt or forward tip. So what we're doing there is I have my diaphragm up here. I've just normalized that and created a zone of apposition. I'm going to do the same thing here. What that does is it takes my pelvic diaphragm or my pelvic floor and my thoracic diaphragm and it aligns them over the top of each other. This allows for greater intra-abdominal pressure to occur in a 360-degree fashion as we breathe. Puts the trunk in a better position, and most importantly, when I go from this to this, I have more freedom to rotate, side bend, all of these things, because there's a decrease in hyperinflation, and my trunk and pelvis is in a better position to move in multiple directions. So our two-factor goal is to establish a zone of apposition and achieve a posterior pelvic tilt with this activity. How do we do that? I'm glad you asked. We need muscles to do that. So to achieve the zone of apposition, we're going to use breathing to do that. But we got these guys called internal obliques and transversus abdominis that as we forcefully exhale, not too crazy though, will pull this rib cage down, back, and in. Because those attach at the pelvis as well, that's going to allow that pelvic tilt to occur a little bit. But of course, abs can't do it all on their own. I have these cool muscles called hamstrings that attach right at the ischial tuberosity. And what they can do is when I contract them in the 90-90 position is they will posteriorly tilt that pelvis. Moreover, I can also make matters even better. So as I tip this pelvis forward, what you're going to see, or in theory, because of the hip flexor attachments, is the pelvic inlet is going to be pulled a little bit more apart this way. Now, it's all relative, and obviously the pelvis doesn't move that much, but just it's helpful to think of that in terms of muscle actions. Okay? If I contract my adductor muscles, which attach along the outside of the pelvis by, squeezing a ball, that's going to, as I posteriorly tilt, pull this pelvic outlet, so the bottom part of the pelvis, apart. That's going to allow my pelvic diaphragm, or my pelvic floor, to ascend. Okay? Because as this shortens, which as these two bones approximate together, the pelvic floor descends a little bit more. So if I can contract my adductors, that will allow the pelvic floor to ascend. What that does, that gets these guys over atop one another, allows me to move with much more freedom, and allows for better intra-abdominal pressure to develop. So that's kind of the arthrokinematics and what's occurring at the joints. But I think there's also some cool things that we can achieve with this position from a physiological standpoint. So let's talk a little bit about breathing. We might also use the 90-90 hip lift to encourage a paced breathing strategy that normalizes pH and carbon dioxide levels. So if I'm an individual who has a higher normal respiratory rate, and maybe I'm more prone towards hyperventilation, which is quite common, what that does is that alters your pH balance and it drives you into a little bit more alkalosis. So pH levels would increase. When that happens, we also see a corresponding decrease in CO2 levels, because CO2 is a little bit more of an acidic component compared to oxygen. This is not desirable for multiple reasons. Respiratory alkalosis, or a decrease in CO2 corresponding with hyperventilation, causes a profound number of unfavorable impacts on our physiology. Increased pH levels and alkalinity will make the nervous system a bit more sensitive. That can contribute to painful experiences, and a multitude of other factors. So by incorporating the paced breathing strategy that we will show you in the 90-90 hip lift, that's going to normalize CO2 levels because we're using a controlled pause. That's going to normalize pH levels, which will reduce the negative impact of respiratory alkalosis. And it's also going to be a very calming and relaxing thing. The more time we spend with exhalation, that's been shown to increase parasympathetic nervous system activity, whereas on the flip side, more time in inhalation or hyperinflated positions or hyperventilation, that's more of a sympathetically driven activity. So this will be impactful for that. The last important thing, because I know obviously we're talking a little bit about more trunk and pelvis, is we'll get an increase in hamstring tone. That can have a favorable impact on knee position. Consider if I'm here. The hamstring is a bit more elongated because of that anteriorly tipped position. What impact could that have on people with knee complaints? Well, if I'm here, my hamstring's eccentrically elongated, it's going to have a much harder time generating force. And because that hamstring is at end range, it's going to have unfavorable activity at the knee. What does the hamstring function as at the knee? Well, we know it's a knee flexor, right? It can rotate the tibia, but it also checks anterior tibial translation. Well, what if I have a hamstring that's already pulled long? Well, I might not be able to adequately check anterior tibial translation because of that. Or, how about this? When I go to extend my knee, I'm already at end range, so I may have a knee extension limitation. I find that by getting that hamstring activity a little bit more normalized and normalizing pelvic and trunk position, that may actually allow some of your knee patients who have that knee extension limitation to be normalized. You don't have to stretch a single thing. To me, it doesn't intuitively make sense to try to force this joint into full knee extension if you haven't accounted for what's going on at the pelvis and the trunk. Now that we understood why we might use a 90-90 hip lift, let's talk about who this is going to benefit. So if you have individuals, like I said, who are extended either bilaterally or unilaterally, also known as a left AIC, right BC pattern. If you're a PRI person, that's the unilateral extension, or a PEC pattern, which would be the bilateral extension. Or if you look in the literature too, this also, the unilateral pattern at least, would be called the zinc pattern. These are the types of individuals that we're going to use this activity on. From a testing standpoint, when you're performing your examination, what you may find is, in terms of a straight leg raise, you'll either see it very, very short or excessively mobile. So 70 to 90 degrees is kind of the sweet spot we're looking for. But if I see someone who's at 90 or above or 45 degrees, this is probably an activity we want to go to. Let's talk a little bit about that. So remember, they're doing this. That's going to pull the hamstring long. So if I'm here like this, if I'm lying flat, and I go to test a leg raise, I should hit end range sooner because that hamstring's already at end range. So that tells me, by contracting that hamstring and getting me to here in the 90-90 hip lift, that should allow for a further straight leg raise. Well, what if I'm this person, and then I could do that? Well, it's clear that there's some laxity that's been developed. And this could occur most likely in the sacrotuberous ligament, because we know that, hamstrings and muscles, they don't really oftentimes get overstretched. It's generally more a ligamentous adaptation. So when I have a deficit in a ligament, what I need to do is increase the muscular demands in order to create stability. It's kind of like if I tear my ACL, the only thing that's going to check anterior tibial translation is going to be the hamstrings. Well, in this case, if I have a hypermobile sacrotuberous ligament or ligaments of the hip that would normally check large amounts of hip flexion or posterior glide of the femur, I would use a hamstring to effectively be a ligamentous muscle for that. So increasing hamstring tone will not only normalize this, but it will also normalize the straight leg raise because I've shortened up that range of motion. You might also use an Ober's test. I know, it's an Ober's test. The IT band, you can't stretch it, blah, 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 blah. We're not talking about iliotibial band length with this test. It's a misnomer. They screwed it up. What we're looking at instead is the ability to adduct the hip. It's a hip mobility test. If I am in this position right here, several things are going to impact my ability to adduct the hip. I could have bony impingement either on the inferior aspect or superior aspect of the acetabulum. I could, because of posterior hip restrictions, have a limitation in my ability to adduct the hip. Or maybe when I pull back into that Ober's test, I can't extend all the way. Well, guess what? I haven't checked the iliotibial band. I've checked hip extension. I've checked their ability to adduct the hip. That's why we're looking at this. So on your Ober's test, you may have a limitation either on the left side, typically, or on both sides. 90-90 hip lift would be a good activity to use in those cases. What else you may see in your exam? Those rib flares that we showed with my guy earlier. You might see it either on the left side or the right side. And that's because if I'm in that zinc pattern or I'm in that unilateral extension, left SC, whatever you want to use, I don't really care. My hips are this way. Okay? So I've turned my hips to the right. My right hip is going forward. Excuse me. My left hip is going forward. In order to face the screen, I have to counter-rotate back to the left. And when I do that, these ribs, my right ribs, are going to drop down. My left ribs are going to pop up. If I want to try to face forward, but I'm not going to do that through frontal and transverse plane mechanics, well, I'll just simply do this. I'll pop this side up, and I'll extend the right hip. So those are your unilateral and bilateral extension patterns. That would be your rib flares, and that's how those things occur. So if you see that, it might be a good idea to do the 90-90 hip lift. What else might you see? Well, if I go up top and I look at the shoulders, I may have an impaired ability to internally rotate the shoulder, predominantly on the right side. The reason why I list that test is because some of the variations and moves that I will show you in the 90-90 hip lift may impact that. Now, the reason that occurs, we think, has to do with rib mechanics. So, if I'm in, let's say right shoulder internal rotation is limited, and remember, I'm in that unilateral extension pattern or right brachial chain pattern. These ribs are down, these ribs are up. As these ribs go down, the back side of the rib cage is pushed back. Okay, I don't know, you probably can't see that, but if I pull these down, you see how these ribs are pushed back? What that's going to do is that's going to alter the orientation of the rib cage underneath the scapula. And so if I push this rib cage back too far, you can see that my scapula has to protract a little bit because it's pushed out of the way. So normally we'd have an appropriate amount of kyphosis at the rib cage and thoracic spine, but if I push it too far, it's going to slide off the end. Or, as you'll see in most people, that right there. Now, if that happens, and I go lying someone down on the table to try to check internal rotation on that right side, that will be limited because shoulders protracted due to rib cage position. I pull them back, boom, I hit a bony impingement. Not going to get range of motion. It has nothing to do with the posterior capsule at this point. From a breathing standpoint, when this goes down here like this, it becomes much harder for me to inhale on this side because this space is closed. This space is a bit more open. If you watch me, I'm here like this. I can't take in as much air because there's nothing for me to expand. All this space is compressed. It's much easier for me to breathe on this side. Whereas if I do this, there's more space for that lung to fill up and open. You'll see that in one of the 90-90 variants I'm going to show you. So that's who would benefit from this test. Let's talk about when we'd use this. This is one of my first activities that I give people in the early phase of rehab. And really, I think that's probably one of the only places that this technique is useful. It could potentially be used as a warm-up if you're feeling like I'm a little bit stiffer than normal and the dynamic warm-up just isn't going to cut it. But to me, this activity shines the most when we're intervening from a rehabilitation standpoint. So out of all those aforementioned reasons, the 90-90 position and all the activities that I'm going to show you are a very impactful way to help our patients. Let's show you how to do it. All right, people. Let's show you how to do this 90-90 hip lift. So some things you'll need. A ball. A small ball. If your patients don't have this, remember, you can use a roll of toilet paper. Just make sure it hasn't been used. Another thing I really like to use, I have a flexion stool. I really like patients to have something like this. So at home they can use, say, a table, a chair, a couch, something to press down into. It's just much easier to feel the hamstrings that way, and it eliminates a lot of the common errors that you'll see with this activity. Last thing, you need a wall. So here's the setup. You're going to put that surface right next to the wall. Or if it's the chair, you just want to make sure that their feet are contacting the back of the chair. You're going to get into the 90-90 position. So that is 90 degrees knee flexion, 90 degrees hip flexion. My heels are on the flexion stool. My feet are glued to the wall. The small ball or toilet paper, unused, goes right between the knees. This is from pelvic down. The only move that I'm going to do is I'm going to dig those heels down into the stool, keeping the feet on the wall, and I'm going to just lift my butt up a little bit. You're going to see my knees are going to go a bit forward or up towards the ceiling. I typically just cue people to lift their butt up a little bit while keeping the back flat. So it's just that there. As soon as I do that, I feel my hamstring working. That variation is good for a person who's unilaterally extended or a left AIC. If they're a PEC or they're bilaterally extended, where both innominates are tipped forward, or you see bilateral frontal and transverse plane limitations in mobility, a little tweak you can make, just IR the femurs a little bit more. That's going to bias those adductor muscle groups a little bit more, which will allow you to open up that pelvic outlet. And you'll do the same thing. You're going to hold this position for 5 breaths. Now let's talk about the breathing sequencing a little bit before I demonstrate it there. Here's how we're coaching the paced breathing. Because remember, we got these rib flares popping up here, right? I want to emphasize a complete exhale first and foremost. So by doing that, and a lot of these cues I got from Bill Hartman, so shout out to him because he's profoundly impacted my way that I coach this more effectively. I want a controlled long exhale, emphasizing a sigh. And the reason why I emphasize that sigh is because that sigh at the end helps get that rib cage to drop just that little bit. So the exhale, prolonged, get all the air out that you can. After they've gotten that full exhale, allow your individual to quietly inhale. That's what I tell them, quietly inhale. So I'm here. That's it. Okay. What the quiet inhale allows us to do is it keeps this rib cage glued down. If I go with a forceful inhale, my accessory muscles are going to kick in. I'm going to lose rib cage position. I typically coach those two things first. Once they've gotten that down pat, then we'll throw in the pause. What the pause does is that keeps us in that parasympathetic exhalation state a bit longer. It allows the diaphragm time to ascend, achieving that zone of apposition, and it keeps the abdominals kicked in and the hamstrings kicked in a little bit longer from an isometric contraction standpoint. So, when I cue that, it's full exhale, get that sigh, like you're 16, your parents told you had to clean your room before you could go out. That's the breathing sequence. So, apply that to 90 hip lift. Again, hips and knees at 90 degrees, ball between the knees. I'm digging those heels down, lifting the butt up, hamstrings working. Let's get me some abs by using that breathing. So in through the nose, long exhale. Think about pulling the rib cage back towards the mat. If you get it right, you're going to feel increased pressure of your back into the mat. Then I'll pause. Now, say I wanted to address that right shoulder limitation that we had talked about. Simple fix. Right? I need to bias that left side a little bit more so this can open up. Easy way to do that, throw the arm overhead. When I do that, that effectively elongates that right side, and then I'm going to get in the same position. And as I exhale, just going to emphasize left ribs and left abs a little bit more than I am right. And then as soon as I do that inhale, I feel that right side expand. Now that is variant 1 of the 90 hip lift. Pretty simple. Let's say you want to really emphasize the breathing piece, which kind of a big deal, so I would. You might consider using this newly enhanced therapeutic device called a balloon. This is different from a straw because the straw only allows for forceful exhalation, and it's a little bit different from an incentive spirometer because that's also an exhalation-based device. This is an exhalation and inhalation device, and here's why. As I exhale into this balloon, obviously I'm emphasizing an exhalation against resistance, so I'll be able to get more air out. But the real key is the inhalation and the pause. Because when I pause while holding this balloon, I have to make sure that I keep the air in the balloon. It doesn't go back in. When it does happen in clinic, though, it's really funny, so let your patient screw up a little bit. So I exhale, I have to keep the air in the balloon. How am I going to do that? Two things. First thing is my tongue is going to go on the roof of my mouth. That's going to put some pressure on the palate and allow the neck muscles to relax a little bit more. So then when your patient goes to inhale, they can't use as much accessory muscles to do that. Well, if I can't do that, how am I going to get that air in? Guess what? I got to keep this rib cage down, so it's going to force me to keep that zone of apposition normalized and my internal obliques and transverse abdominis to be a bit more active. So you're allowed, you create better intra-abdominal pressure. You prevent accessory musculature from kicking in. And you get an inhale where the diaphragm descends normally, and that allows air to expand where it needs to expand in the apex of the lungs. So the balloon is cool for a lot of reasons, contrary to what the haters might say. So, just like I had said, the way I coach it first is I don't worry about the pause. I'll let my peeps pinch the balloon. So in through the nose, blow out, pinch it, go again. Okay? Still funny after all these years. Now, when I'm doing it in the 90-90 position and I cue that pause, I won't let them pinch. Instead, they're going to put their left hand right in front of the balloon so it doesn't go shooting all over the place when they, or if or when they lose the balloon out of their mouth. So let's talk through it again. It's in through your nose, long sigh out into the balloon. Once you've gotten all your air out, pause. Place your tongue on the roof of your mouth to keep the air in there. Relax the neck muscles, force the abs to hold the rib cage down. After 5 seconds, take another quiet inhale in. Let's see it. So, I got my feet on the wall. My heels are pushing down into the stool. Got that arm up overhead so I can feel air on that right side of the lung, especially the upper aspect. Balloon's in my left hand. Let's lift the butt up, in through the nose, onto the balloon. That's pretty much it. So let's say your peeps are having a hard time really getting the left abs. A little tweak you can make to this. And I guess we'll call this section how to progress this. So if I can't get the left abs, what I may do instead of having my arm up here is I'll reach. Because as I reach, I'm using my serratus anterior to rotate the trunk further to the left. As soon as I do that, I feel those left abs kick in a bit more, right? So I'm breathing in, exhale, reach. I feel left abs big time. I'm going to hold that position. Exhale and reach. Simple tweak, you can make it. Let's say I want to make this a bit more intense from a lower body standpoint. Well, what I can do, pretty simple. Lift one leg up in the air and do the hamstring activation unilaterally. My guy is sizzling. That also has a lot of good benefits because remember, a lot of these individuals are going to be unilaterally extended. And so if I emphasize flexion or posterior pelvic tilt on one side a little bit more effectively, that may allow us to be able to shift and go to the other side. So, simple thing, take both heels down, straighten one knee, take your 5 breaths. The pinnacle, in my opinion, is to combine those last 2 things that we just talked about. So I reach with an arm, I reach or straighten a leg. Let's use both. So what I'm going to do in this case, and this activity is called the 90-90 alternating crossovers, is I'm going to lift my knees up, butt up off the mat, straighten the right leg, and I'm going to use my opposite hand, the left hand, reaching towards the foot. So in through my nose, exhale, reach. I want to make sure that my left low back on this stays glued to the mat. And the reason why that is otherwise I have a tendency to extend and I'll lose the rib cage position. So think the more pressure you put into the mat, your low back into the mat, the better my rib cage is going to stay in that ideal zone of apposition position. So I do that side, 5 breaths, alternate, do the other side. That activity right there is great for those patients of yours who are bilaterally extended, because you're getting them to alternate flexion and extension and rotation on either side. And that's something we'll all need to be able to do, but especially those individuals who can't access frontal and transverse plane on either side. Now that we've talked a bit about how we can progress this, how to perform the 90-90 position normally, let's talk a little bit how our peeps will screw this up. Screw up number one. I see this all the time. It drives me bonkers. Instead of lifting up, what they'll do is they'll push their feet into the wall and do that kind of thing. Doing some kind of lame bridge. Okay? Why are they doing that? Trying to extend, to lift themselves up. It's an inability to coordinate flexion-based musculature. So how do I cue that? That's why this is here. I used to do it where I didn't even use the stool and I just had them try to scrape the wall. I just found that to be very ineffective because they inevitably just don't get what that means by lifting their body up, and instead will just push the wall like that. So if you give them a stool, a chair, or whatever, have them put their feet on the wall, you're going to cue them to push down into that stool or that chair. And I'm not going to be pushing into the wall. The wall is just there for feedback in terms of keeping your whole foot on the ground, so it doesn't seem like you're hovering. The other thing they'll do, as they go and lift their butt up, they'll lift everything up like this and say, hey, am I doing it right? No, you're not. How do you fix that? A couple ways to do that. First, I will put my hand on the lower back and just say, keep touching my hand, and then just lift your butt up a little bit. That works well. If they're still not getting it, what I may just do is just have them squeeze their glutes a little bit. Because sometimes that might be enough in this position to get a posterior pelvic tilt where they get a little bit of hamstring. Then eventually you would progress them to the former cue. The other problems that will happen with this activity will be with the breathing side of things. Okay? So let's say they're not achieving a full exhale. Or you'll see that a lot. You want to make sure that you're cueing a sigh. You may put your hands on their rib cage and help guide them down to fix that. You can also, if you're not a fan of the balloons and you just want to emphasize the exhalation piece, use a straw or use an incentive spirometer. Those work great. Or not an incentive spirometer, but a spirometer. Those work great. Let's say they're keeping a loud inhale this time. Let's say that's another error. They're doing that type of thing and the ribs are popping up. Fix for that, pressure on the low back. Make sure you keep that pressure as you're taking air in. Also tell them the inhale needs to be silent. Those are all pretty much the errors that you'll see with this movement. All right, so let's say that the 90-90 position just isn't happening for whatever reason. Typically the reason will be that they cannot posteriorly pelvic tilt against gravity. That's been the largest problem that I've seen, whether their back comes up or they just stay arched or a multitude of things. So to provide some regressions for that activity, what we'll do is switch to quadruped to start. And this is called a modified all-four belly lift, again from PRI. So what we'll do in this position, it's just a little bit easier to perform a posterior pelvic tilt and coach that. So I'm going to start in hands and knees. And I'm going to cue my individual to tuck their hips up underneath them, just like so. Then I'm going to push down towards the ground as much as I can so I get a little bit of this movement happening here, which is a scapular protraction and then rib retraction. What I'll cue my patients to do in this position is I'll put my two fingers right here and I'll say, I have the Zika virus on my fingers. Don't let me get you. You can use whatever disease is in vogue in your area for this. Zika virus is in right now. So Zika away, tuck the hips, take your 5 breaths. In through your nose, long exhale. Think about pulling the rib cage up towards the ceiling so you get that zone of apposition. Then inhale again. Let's say they can't do that. That's a challenge. A lot of times people will get neck tension during this, as an example. You can shorten the lever arm by keeping the tuck, but switching to forearms. It's the same position, in through your nose, out through your mouth. I'm still doing the Zika virus reach, but I'm pushing through my forearms this time. Let's say they can't do that. Maybe they're still having a hard time figuring out that posterior pelvic tilt. Well, then we can just, once I'm on forearms, rock back into rock back breathing. Right here like so. And then I'm going to do the same thing. I'm going to do my same reach. You see I'm forced into a posterior pelvic tilt because my butt is touching my heels. And I'll kick out my 5 breaths. In through the nose and out through the mouth. Those would be some regressions that we can use. And kind of once they've figured out what they need to do from a posterior pelvic tilt standpoint, go back to the 90-90 position, see what you can get. All right, guys, that's it for today's movement deep dive on the 90-90 hip lift and all sorts of variations. I hope you guys get a lot out of it. Use it in the clinic. Comment below. Let me know what you think. Keep it classy. Deuces.